Welcome to this series of short videos on the Secure Pork Supply Plan. They are intended to supplement the information found at the website securepork.org. My name is Dave Wright, and I'm the Minnesota coordinator for this project. This video will focus on classical swine fever, or hog cholera. Hog cholera is one of the foreign animal diseases that causes septicemia in pigs. That means that the virus will run all through the body of the pig. It was eradicated from the United States in 1978, but it's still present in more than 35 countries, including South and Central America, and it's even as close as the Caribbean islands. Much of Asia is infected, and there have been recent outbreaks in Russia, Bulgaria, Brazil, and most notably, Japan. It's a highly contagious virus. The virus can be found in blood, saliva, urine, feces, and tissues. It's transmitted by ingestion of contaminated garbage or meat products, and also by direct or indirect contact with fomites. Less commonly, pigs can get infected by aerosol, semen, or vectors. But in contrast to foot and mouth disease, infected pigs are the only reservoir. No other species are affected or infected. The incubation period for hog cholera is 2 to 14 days. The disease itself can present itself in a variable form, sometimes from acute fatalities to being asymptomatic. If a pig is infected with hog cholera virus, it can remain persistently infected for quite some time, for months, and shed the virus. Yet the virus can also be passed from the mama to the baby piglets in utero. One of the big challenges with hog cholera is that it can mimic some of the other common swine diseases. If we look at this differential diagnosis, the ones that most of our producers might be familiar with would be acute PRRS, erysipelas, or salmonella. But all of these other diseases are things that can look very similar to hog cholera. The signs usually begin with a high fever, and with fever, of course, comes huddling and weakness of the pigs. They go off feed, they're drippy eyes, they can get diarrhea, they can even have central nervous signs. Cyanosis means blotchiness of skin and the skin hemorrhages, and of course we can see death. Since most of the producers are doing a lot of postmortems on their own, I thought it would be important for them to see some of the postmortem lesions. This one in particular is a cross-section of the kidney, and this lesion right here is unique to hog cholera virus. If a producer, or if you see this, drop your knife, call your veterinarian, and certainly restrict your movement to any of the other farms in the neighborhood, or restrict access to your farm because of the potential of being an infected premises. This is what that kidney looks like before you cut across it. And this is what the kidney looks like when you're first approaching it. And when you peel that covering away, you're going to get this turkey egg type of kidney, which is all of these little petechial hemorrhages. And if you cut that surface, there's a tremendous amount of fluid in the inside of the kidney, and then all of these little spots that are hemorrhaged around the outside of the kidney. The lymph node is one of the new tissues that will be tested for classical swine fever. In the past, this right here is the tonsil, and in the past only the tonsil was selected as a tissue that is going to be screened at a diagnostic lab. Now, lymph nodes and also the spleen, which is very easily found in a postmortem, can be submitted for tissues, so make sure to include those when you're submitting tissues to a diagnostic lab. This is what the lung looks like with, again, lots of hemorrhages and fluid. And this, again, is the throat of a pig that was infected with a chronic infection of hog cholera. This pig had a pretty sore throat before it died. Remember to suspect classical swine fever or hog cholera in any pigs that have septicemia and high fever, particularly if they've had a history of being fed garbage or scraps, or if you've had any international guests. Remember that a diagnosis is impossible without laboratory confirmation from a specially trained veterinarian, a foreign animal disease diagnostician. And if you submit samples to the diagnostic lab, if you can find the tonsil, submit it, and also include spleen and lymph node. I'd like to make a special acknowledgement to the College of Veterinary Medicine at Iowa State and USDA for providing us with the slides of the tissues on the postmortem exams. I'd also like to acknowledge and thank these individuals for providing information for this video. This series of videos has been produced with the help of the Minnesota Board of Animal Health and the University of Minnesota Swine Extension staff. Thank you for your interest in the secure pork supply.